All right, well, here with Dr. Bauman and Dr.
BHC.
BHC, and we want to give you kind of a look at what a day in the life of a BHC is like. Now, we're at the office early. It's 6 a.m. That I don't think is necessarily typical for a BHC to do or have to do. But we like to get in early just because it's quiet. We like to get notes done, answer emails, and a variety of different things. So let's go start the day. All right, so we're coming down into our BHC office space. Now, any BHC knows not to necessarily have an office space, but with us doing a lot of admin work and clinic work, we have our office space that we come down here. I was gonna say it's a bunch of cubicles that we have our core BHCs, our interns, our other core BHC, Bridget, since she's the boss. She gets her own office here. And as we said, when we're in clinic, we're not down here. We actually chastise people if they're in clinic and we find them down here. But this is just a space to get work done and get notes done, answer emails, work on admin projects. So it's about, I'm going to try to actually look at the camera rather than look at the screen. So it's about 6:15, still early in the morning. As we did in our intentional video, Bridget and I have a morning routine that we like to do to bring us present to the day and just get our minds prepared and prepped and primed for what the day is coming. So that starts with me doing our high performance planner right here that I have already somewhat filled out because of doing this at the beginning on Sunday, just filling out the day of the week. But now I'm going to go through the specific questions of what's my message to myself, top 3 goals, priorities today, and set some in clinic. It's going to be largely related to clinical aspects, such as getting handoffs, answer the questions, the situation that might stress me out today. The one that usually is absolutely going to go on today is multiple handoffs coming in at one time, and then answering how my best self would deal with that. And it's usually pause, stay present, and get them all will be the response. So just bringing some intentionality to the day to start it off and making sure we know what's coming through the rest of the day. Okay, so it is around 7:43 right now, and so that means when we start to go up to clinic to start to huddle and round with our teams, which we're going to try to show you as well today. Looking at the schedule, this is a day that I'm in clinic the full day, so I have 10 patients scheduled throughout the day, some of them already being paired with a medical provider visit, so we'll do a co-visit or a paired visit with them. And within those 10 visits, we're also looking to get 3 to 4 handoffs throughout the day, and that's usually what we're averaging per BHC is about, when you're in clinic for a full day, about 3 to 4 handoffs that will come through for that individual BHC. I'm trying to think of other things. Looked at my schedule, did a little of chart prep, reviewed some of the goals from last time. A lot of these people I've seen a couple of different times. Some this is the second time seeing them. Others that these are patients that I've been working with for a while now. That had that continuity of relationship, that continuous relationship throughout primary care, and making sure that we're coordinating it with the PCP, working on different things. A variety of different people coming in for traditional mental health things, also working on lifestyle, diabetes, weight, so a lot of just different things, relationship problems. So it's really a pretty variety. This is kind of a reflective of what a typical day in PCBH is like. We're heading up to the clinic because our office space, as we're just coming out of, is actually downstairs. And it's another thing that we did relatively intentionally because, as we said, when you're in clinic, you're upstairs. You're in clinic, you're not downstairs writing notes, you're in the mix of it. So we'll get started through here and we'll show you around as we go into our clinic space. And some of the providers will be here, most of the MAs and nurses will be here for us to be able to huddle and round. So we'll be able to go through that real quick. So it is 7:47 in the morning. It is me and our awesome blue team nurse, Melissa, there, that are getting prepped for the day. The one thing that we always like to show is our boards that you can see the medical providers that are on in the morning with their MAs, likewise the BHCs that are on, so when handoffs come through, they know to teams those specific BHCs, and then the afternoon schedule as well. So these are pretty common in all the different teams, and as we walk through, You can see our exam rooms that we have. The little blue flag, that we use a flag system. Little blue flag has, it's reversed from me, has the BHC logo. So whenever the BHC is in the room, we put that flag out, or if there's a need for a BHC. This is actually my exam room, as you can see by the little Dr. Bauman. This is my exam room. Looks like a typical exam room. Light comes on there. And it's a functioning exam room. Now, we did that for a number of different reasons. One is the obvious one. We didn't want to have any change or any indication whatsoever to patients that there's a difference between what is physical health and mental health. It is just health overall. The other reason is, when I'm not here, and I'm about 40 to 50% in clinic, so that means, 60% of the time this room would be vacant, that they can use that as an exam room. So, and then also, if I'm meeting with a patient, I need to do a reverse warm handoff to one of the PCPs, they're able to do that and just come into the room. The patient doesn't have to move, they can stay in the room. Now, when we do handoffs, largely we have enough rooms that we get just to stay in the room. If, though, we need to bring the patient over to this room, we can, and if I have scheduled patients, I'll see them in here. But yeah, just a typical exam room that we have. There are some flyers and handouts. All right, then let's go see if we can start rounding with some people. So this is going to be an interesting day because we usually have a lot more. There's our BHC intern, Kristen, who's sneaking away right now. But usually we have, we're usually 9 to 12 PCPs on, but this is our resident retreat day, snow day, so we have less providers on. So it's actually going to be somewhat of an interesting day to see how many handoffs, even though I just reviewed one of the PCP schedules, and as it would be in a primary care clinic, it's pretty packed with stuff. Let's check out Purple Team, who is not in here yet. Let's see if they even have any providers on. They do. They have one provider. So as a reminder, just what we saw on Blue Team, this is Purple Team, the providers that are on, and then the BHCs that are on for that. So as we get closer to that 8 o'clock, providers should be coming in, medical assistants should be coming in, we'll round with them, and we'll be able to show you that. Okay, so as we were saying, one of the things that we do every morning is make sure to huddle and round with all the MAs and PCPs to see who's coming in. We got an awesome Blue Team MA, Liz, here. And one thing that's really good about all the MAs and the nurses is that they do a great job of identifying patients for us as well. So while we are collaborative about this, even yesterday, Liz, before one of the PCPs even went in, was able to get one of the BHCs to go in first because the PCP was running behind a little bit. It really helped streamline their visit. And it seems like our Dr. Robinson seems like she has a decent amount of stuff coming in. So I don't want to show the schedule because obviously that would be releasing patient health information, which we won't do. But it seems like she has a pretty typical morning. A couple diabetes, let us know about that. Obviously the anxiety, anything comes up with the blood pressure. Then yeah, she has a row here, huh? Yep. Depression, anxiety, sleep, ADHD, and especially since it's at the end of the morning. Let us know if we can maybe go in first like we did last time. Yes. Perfect, even double booked there too. She's double booked like this whole way, yep. Huh? Yeah. So this is a really good moment, right? Because Liz does a great job of, if Dr. Robinson's running behind, obviously the patients are going to be here, that the BHC can get the visit started and maybe really help streamline some things. So definitely let us know. Cool. Thank you. Awesome. Okay, so just rounded with all the teams, checked in on the providers, our BHC interns who are also on with me. There's 3 of us on this morning. They were also rounding as well, and it's about 8:09. I'm scheduled, usually our first appointment's not till 8:40, so in case we can make sure that we can huddle, and if there's someone that we can see right away that's a handoff, to have that flexibility. So I did squeeze a phone call in real quick. So we don't have phones in our exam rooms, and this is a really big thing about thinking about workflows, about how to make sure that we can still complete things, especially telehealth, in a way that protects patient health information and then also doesn't take us off the floor. So I was able to find a quick office space that I'm gonna just do the phone call real quick, and then it will put me back out in the exam room and next to the providers. We were using one phone system, I'm not gonna say the name because I don't want to blow them up, but they, what's really interesting, they switched last year to that it can only be physicians that get free use of their calls, and that anybody else has to pay for it, which is really interesting. So I usually would just do the phone call via my cell phone in the exam room, but I can't do that anymore. So I found a quick little office space, one of our faculty office space that's on the floor. I'm going to do the phone call real quick and then get back on the floor to see the rest of the patients and really make sure we're supporting our PCP. So I'll pick you up after that phone call. Okay, well, it's about 9:07. Just got done with the phone call and 8:40 patient as well. So 2 visits completed this morning, and really a tale of 2 different types of visits. One, where a phone visit that went a little bit longer, patient was struggling for a variety of different things, so it went a little bit longer. Then the 8:40 visit wrapped up in about 12 to 13 minutes. Patient came in. This was a checkup, the 3rd visit within this episode of care. I've seen this patient for 4 or so years ago. Just on and off, and she was doing really well, making a lot of progress, and so we're following up as needed and kind of reflecting that point of primary care is that when you need us, we're here, and to come up and the visit, as Dr. BHC always says, the visit takes as long as the visits take. So that's what we're doing right now. Right now, I'm going to put my mask back on because, like a good BHC, and like the article about bumpability showed, we want to make sure that we're out in the medical pods, sitting there being ready for our medical teams. And as I said earlier this morning, it's a unique day because we only have, I think there's a total of 5 medical providers on, which is so rare. Usually it's at least double that, and we have 3 BHCs on, so we're going to have to really try to work our magic and have our MAs really help with getting handoffs, making sure that we're getting in visits. And our one PCP I'm going to check on right now definitely seems like her morning was filled with some potential patients that might utilize BHCs or need BHC. So we're going to go talk to them and see what we can do. All right, check in soon. I just finished up a visit. Liz did a great job getting us in for a handoff. It's for him, correct? Mm-hmm. Okay. Just for anxiety. Has he seen us before? Or?
Nope. He hasn't seen us.
Awesome. Well, this is why Liz is awesome, because she got us in before. Robertson hasn't got in yet?
She's in now.
She's in now?
Yeah.
Oh, perfect. So this is great. So I can switch in off then. All right. We'll catch up after that. All right, well, I want to do another little check-in in our exam room, so I'm just not disrupting everybody out on the floor. It's 10:34 right now. Just got done with the handoff, a really great handoff that was initiated again by our MA, Liz, who did a great job. We had huddled, obviously. We showed you in the morning about some particular, this was a patient that we had identified that might be useful. They hadn't seen a BHC before, coming in for anxiety. Liz brought it up, sold it really well when the patient checked in, provider went in, I went in afterwards, 20 to 25 minute visit, did a lot of great work on self-compassion and anxiety. It made sense why the anxiety was there for sure, and he was already doing a lot of great things, so just really great. So 10:35 in the morning, we've seen 4 patients so far, a variety of different things that are coming up. I have 1 more patient scheduled, and then hopefully get into maybe 1 or 2 more handoffs before the lunch starts up, but another good day. I wish I could have showed you about how, because I was in the visit with my 920 when I got the handoff request via Teams. I wish I could have showed that and demonstrate that. Obviously we can't with the patient, but just to let you know, Teams came up on my visit. I responded very quickly, hey, I'll be there in 10 minutes, keep him here, and definitely was able to complete the handoff. And that's our goal, making sure that we get every single handoff that comes in for that accessibility. So 10:40 right now. I'll check back in maybe right at the end of lunch, and we'll call that a day. All right. Okay, just finish up the 5th patient of the day. It's 11:20, so 5 patients from 8 a.m. to about 11:20. Hopefully to get maybe 1 or 2 more handoffs before lunch starts. Usually my mind beats me up if I don't see at least 6 patients in a half day. So we're at 5 right now, so hopefully we get another handoff, and I think there might be a couple coming down the line. You know, one thing that my mind is just wanting to touch on this video, I just got done with a patient that was in a methadone program, and now unfortunately she got expelled from that program, kicked out of the program. Variety of different things, and is using heroin every day now, and we're trying to get into our Suboxone program. And I think the thing that is always just amazing is that when we're able to see people for them, all these behaviors start to really make sense, and the grace and compassion that we must have with our daily interactions with patients just comes, I think, so much more naturally when we hear about the individual, which is like a no duh kind of moment. But I think a lot of times as a BHC, and particularly when we have these 20 or so minutes, we get so much pressure on making sure that we get a plan done, which we need to do, and we make so much pressure on doing the right thing and the algorithms and whatnot. And a lot of times that sometimes takes us away from the present moment, being with that individual. And that's the thing that I felt today with the patient, is that she, as much as we're not going to endorse using heroin, makes sense. And there was a lot that she was still doing well, right? That this isn't an either or. She was showing kindness and compassion towards herself. This was actually a follow-up visit that is paired with a medical visit today, but she was showing kindness and love towards herself through specific activities. She was very appreciative of being able to come in today. She was very genuine, very honest with her substance use. It was just an incredible kind of visit, and one that if we would have focused solely on the problem, the heroin use, we would have lost all these different things that she was doing so well for. So I don't know what my mind is trying to say, but it just, these are some of the most rewarding patient visits that we have, is where we get to see people for who they are, and particularly in the PCBH setting. So yeah, just a lot of gratitude that my mind is sitting with right now, which is cool. So yeah, 11:24 right now. Hopefully maybe get one or two more handoffs. We'll see how it goes. I'm going to go pestering our medical teams. And one thing I was thinking about, what's really important, is that these conversations that I get to have with the MAs and the PCPs before going to see visits, we really can't record in a lot of ways because we're talking about patients. I was thinking about pulling it up, but we're talking about patient health information, which we can't show. But just know that we're out there, we're talking in the medical teams, we're going back and forth about just different options and collaborating regularly. So I wish we could still show that portion of a day in the life of a BHC working in primary care behavioral health, but know that that's happening as well. All right, well, I think that is going to wrap it up for the morning. It's about 12:05 right now, and our PCPs are basically done for the morning, and I was able to get all my visits done. Wow, I didn't get to the 6 that I wanted in the half day. We got 5 visits that were really great. A handoff, another one that was paired with a medical provider as well, and a couple people that followed up. So really just great team-based care, great work. It was a slower morning just because of the number of providers that we've had on, and our interns do a really good job of also covering handoffs, and they got some handoffs as well. So we did a good job supporting our PCPs, reaching our community, fulfilling that GATHER acronym. And I'm going to sign off for the day, even though I'm in clinic this afternoon. I think it's going to be the same thing as we did this morning. So that is what a day in the life of a BHC is. If you have questions or comments, reach out to us, because we want to get people excited about potentially becoming a BHC, show a little bit of glimpse of what it is like. And I can't say enough how fulfilling of a job it is, how rewarding of a job it is, not only to work with our team members and to work with such caring and passionate MAs and medical providers and nurses and care coordination and front desk staff, but what we get to do with patients. Do we get to access patients that would never otherwise see a mental health provider, and also patients that, you know, coming in and trying to improve their diet or their exercise or their lifestyle or quitting smoking or improving sleep, that we get to impact them as well, not just the traditional mental health. So a really good start to the morning, a really good start to this Friday. Thanks for joining. As always, reach out to us with any questions, but I hope you enjoyed the day in the life of a BHC.